We all are currently facing a global pandemic called COVID-19 that we know of since December last year. Right now, 1.2 million cases and 68,000 deaths have occurred worldwide due to this disease. Hello and welcome to the Events of Life. Today, we will discuss the latest updates of COVID-19 and how to protect yourself from this virus, so stay tuned. Please click the like and subscribe button. Also, please share this video and continue to help spread the word as we continue this journey to stay safe and healthy. Before we jump into it, let's get to know what COVID-19 is. Well, COVID-19 is an infectious disease which causes respiratory issues such as cough, difficulty in breathing, and fever. It is caused by the severe acute respiratory syndrome Coronavirus 2. It was first detected and reported by China in December 2019. Just after a month, in January, WHO declared public health emergency due to the rapid increase in number of cases and deaths across the globe. Let's see why is it called a pandemic. In March, the classification of coronavirus was changed from epidemic to pandemic. Pandemic is when a disease is spreading in different parts of the world and affecting many people at the same time. Presently, COVID-19 has affected 205 countries and territories with around 68,000 deaths, and that's why it is called a pandemic. Even though the epidemic began in China, by the end of March, cases in China and South Korea had dropped down due to the implementation of safety measures and testing. However, by this time, coronavirus started spreading to other countries, and soon Italy became the epicenter of this pandemic as its death toll surpassed China. At the moment, USA's coronavirus death toll is exceeding Italy's and China's. Majority of deaths in Italy were among the elderly population. At present, 14,381 deaths have been confirmed, 85% of which are the patients who are more than 70 years old. Undoubtedly, elderly and people with underlying issues are the most affected, but this doesn't mean young individuals are immune. Around 20% of deaths in Korea were people under the age of 60, and 15% of young people in Italy were in intensive care units. How to deal with COVID-19? There is currently no vaccine available. However, research has been carried out to develop an effective vaccine. According to an article by Harvard Business Review, even after China's experience with COVID-19, Italy's officials took time to implement strict social distancing measures. Most important step is maintaining distance and avoiding contact. These measures should not only be implemented by government but also be followed by the public. Despite the growing importance of social distancing, public seems to be ignorant of the government directives. In order to avoid more loss of human lives, a contribution from both sides is required. Social distancing means traveling only for essential purposes, avoiding places and crowds, and maintaining distance with an infected person. The best way, in short, is to stay home as much as possible. The best way to prevent illness is to avoid being exposed to this virus. Maintaining a distance of about 6 feet is highly recommended. Also, using a mask, washing hands, or using alcohol-based sanitizer is effective. Now let's move on to the next question, which is a major concern lately. As per the current evidence based on cases in China, it was found that this virus is transmitted through respiratory droplets of an infected person. Therefore, as per WHO, it is not an airborne infection as it is spread through direct or indirect contact with an infected person. On the other hand, some researchers assert that this disease may spread from smaller particles called aerosols which float in air. Therefore, it could be said that COVID-19 is airborne as there is evidence showing that the virus remained in air for 3 hours. Since COVID-19 is a new disease, further research has been carried out to detect different modes of transmission. Either way, staying home is a key to stop the spread of this virus.